afternoon. I understand you've been experiencing some severe abdominal pain today. What I will do is have a good look at your tum, alright, and just see if I can figure out what's going on with you. Alright, my lovely. Okay. So, a couple of questions for you, if that's alright. This will help me determine what's happening. So, when did this pain begin? Did it start suddenly or was it gradual? Okay, so where is the pain exactly? Right. Okay, now is it sharp, pressure, cramping, throbbing? What kind of pain? Okay, like contraction pain, okay. Contraction pain. So like a tightening, squeeze. Yeah, okay. Okay, so it kind of comes in waves as well, okay. Right, any pain anywhere else, or is it literally just your tummy area? Okay. Any nausea or vomiting? Any loss of appetite? Any bloating? Okay, so maybe slightly on the upper tum. Any fatigue? Okay, so you feel quite drained and tired, and your legs feel a little bit uncomfortable. Okay, and they just kind of feel a bit heavy. Yeah. Okay, now any digestive changes such as diarrhea or constipation? Okay, so you haven't been to the toilet. When did you last eat? Have you just not wanted to eat since, or is it because you've not felt like eating? Okay. Right, so obviously we do need to check for appendicitis. That is something that I will be assessing, alright. And making sure that there's nothing going on, alright, that needs urgent treatment. Okay. So, okay, that's that one. Have you had a fever at all, my lovely? Okay. Is there any chance that you could be pregnant? Okay. Okay, now, any other symptoms or things that's going on that's not necessarily linked to this, but it could well be? Yeah. Right, okay. Okay, right. If I could just have a look at your tum, please. So if you can just raise your top so I can just have a look at it. How much do you weigh, my lovely? Thank you. Have you noticed any changes in your weight? Okay. Skin looks nice and even. I can't see any obvious lumps or bumps sticking out of your tum. Alright. Can't particularly see any swelling. Alright, looks quite normal. Okay, which is all good. Right. So let's pop on some gloves. Okay, so I can have a feel around. Have you had this before, or is it the first time? Mm-hmm. Okay. Right, am I okay if I touch? Okay. I'm just lightly touching to see if I can feel any lumps or bumps, okay. Help check for any hernias. Okay. Okay. Okay, I can't feel any obvious lumps or bumps or anything out of the ordinary. I'm now going to go a little bit deeper, alright? Now tell me if you can feel any pain or discomfort. Okay, so when I'm touching, it feels quite tender. Alright. So just all over. Okay. And about there, is that the worst? Okay. I'm just going to go deeper here. Alright, you're doing really well. Okay. Just possibly a bit inflamed, maybe. Okay. Okay. Just gonna go here and feel the top. So this is where you tend to feel bloated. Okay, I'm going to push a little bit deeper. Does that hurt? Okay, what about here? There? Okay, just keep nice and still for me. Squeeze and roll that around a bit. Okay, so here you actually have a lump. It is a lipoma, fat lump. Okay, so it's actually quite large, my lovely. So this could be why you're feeling quite bloated up at the top here. Okay, now it would have started off quite small and they can stay the same size, they can grow bigger, and in this case this has grown a little bit more on the larger side, which could be why you're feeling quite bloated. Now, have you noticed that? Okay, so you don't always notice it unless you're kind of like touching your tum and things like that. I don't think that is causing this issue that's going on today, but that could be why you're feeling bloated up top. Alright, yeah, I mean, we can look at getting that removed, and if it keeps growing we're going to have to, because that's going to be really, uncomfortable for you. you know, they're non-cancerous, my lovely, okay? And the way it feels, the way it moves, it does show to me that it is only a fat lump rather than malignant, okay? I mean, we could do an ultrasound on that area in particular, or carry out a scan if it was causing you some problems, which from what you've described, the bloating and the pressure up the top is, you know, it's clearly causing some kind of problem. So I do think we need to have a look at that. I don't think it's related to this issue, but it is worth getting it looked at, and then, you know, see what we can do down the line. All right, my lovely. But that could be why you're feeling that there. So, you know, if you're going to get cramping and contractions in your tongue, it's going to be squeezing and it's going to be pushing on the lump and actually causing you a bit more discomfort. Or, you know, if you're full and things like that, okay. But other than that, it feels all right there. Okay. Now, I can't feel any swelling or lumps or anything like that in the other region. All right, everywhere else there looks perfectly fine. I can't feel any hernias, any other kind of lumps or anything. It feels nice. Okay, but I am going to go a little bit deeper in certain areas now, okay? And I want you to tell me if it hurts, if it feels uncomfortable, or if you can feel anything abnormal. All right. Okay, I'm going to go a little bit lower, if that's all right. Any pain there? 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 Okay, so it doesn't appear to be further down. All right, so I'm more inclined to think it's maybe your digestive system rather than your reproductive system, my lovely. All right. No, it's not your appendix, my lovely. All right, definitely not. You would have reacted, so that's fine. You did the right thing by coming in, my lovely, but no, it's not your appendix, so that's fine. Okay, so there's something going on, I'm thinking, in your digestive system. All right, but let me just feel behind. I want to feel your kidneys, okay? Let me know if there's any pain or discomfort. About there. Okay, so that's fine. Okay. I'm just going to hold it there and just breathe normally for me. I'm just going to feel. Right. Okay, I'm just going to push that. Okay. So you've got a lot of pain and discomfort overall, but then it keeps getting worse in waves, real big contractions, and then it eases off. This sounds like it's your bowels, my lovely. believe it or not, we can get like excessive cramping and tensing, releasing, like contractions. Okay, now, are you diagnosed with a bowel disease or IBS? You're not. Okay, I'm wondering if you've got something like IBS or maybe a bowel disease. Okay, I don't feel any ruptures or anything like that. Okay, nothing's kind of screaming to me this is serious. All right, you know, you've had no bleeding or discharge or any abnormal coming out of you, so that's fine. You know, you're not exactly not really swollen or anything like that. From what I'm feeling inside, you do feel a little bit rigid in places. All right, and I'm literally thinking that is what's going on. So I'm going to have a listen and see what your bowels are sounding like. Okay. 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 Oh yes, they are very noisy, aren't they? A lot to say. Can you feel all that rumbling and gargling? Doesn't sound happy. Can you just take a nice deep breath in and hold it, please? Okay, you can breathe out. Okay. It's making a lot of sound. Alright, it's definitely not happy. There's a lot of gargling, bubbling, gas sounds. Okay. Yeah, it's very noisy. Alright, which in itself is quite uncomfortable. Alright. Now, can I have another feel? I need to go a little bit deeper now, if that's okay. Alright. Tell me if it hurts or any discomfort, okay? Okay, I'm going to go really deep here. Alright, my lovely. Okay, you're doing really well. Just breathe, focus on your breathing. Yeah, okay. Keep breathing. Alright, okay. Now, you've definitely got some swelling at the beginning of your large intestine. Alright, my lovely. Okay, now when we have what we call irritable bowel syndrome, IBS, it tends to affect your large colon, but it can kind of affect anywhere really. Now, if you've got something more like Crohn's disease, it can affect your small intestine and the beginning of your large intestine. So that is making me wonder, is it IBS flare or is it something like Crohn's? Now, with the swelling, I am more inclined to be wondering about Crohn's. So there's definitely something going on there, my love. All right, were you feeling the pain and discomfort when I was touching and then the swelling? All right, yes, so I just need to write a couple of notes. Okay, so you've got the lipoma in the upper. Okay. Large needs scanning. Okay. Right, so no hernias or other lumps and bumps. so it's all tender. Appendix fine. Kidneys feel fine. Reproductive system is fine. Small bowel, I think feels okay, but large, some inflammation, which is why it's causing obviously a lot of problems. But even if it was something like IBS, you can get things like this when you get severe cramping, severe spasms, contractions. It can be quite uncomfortable for some. It can make you feel like you've got heavy legs afterwards. You can feel fatigued, drained, lethargic. You know, it can just have the pain without needing to go to the toilet, or you'd get the pain and then you could go to the toilet. But a lot of the times you'd feel like a difference over the time. Like it can be kind of a gradual thing. It starts coming and flaring, but this is the first thing for you. That's why it does concern me that there's something else going on other than just IBS. All right. Yeah, I mean, you said you have no issues normally, you know, you tend to go pretty regular. You don't really have either or diarrhea or constipation. And this time, a lot of it is you're experiencing this severe pain, and obviously I can feel the swelling. All right, my lovely. So I'm going to question IBS or an IBD. Okay. Now, I would have to get you to see a gastroenterologist here, my lovely, okay, and they'll be able to examine properly and do some tests and things like that. Now, there's a lot of things that we can use, like you can do like colonoscopies, gastroscopies, you know, we've got all sorts of different things. We can do laparoscopies to have a look as well. There's different scans, you know, but a lot of that, you know, does require us emptying our bowels. Some of that is a little bit unpleasant, but, you know, it can give us answers. So, but what's concerning me is the inflammation and the pain that you're in. Okay. No problems with the spleen, my lovely, or the gallbladder, appendix. That's all fine. Okay. I'm going to touch your tongue. Now, can you cough for me? And again. Cough. Okay. So pain increases when you cough. Right, now can you just move your legs like sort of riding a bike and scrunch a little bit? Okay, so moving around is causing more pain. Okay. Can I have a look at your mouth? You can pop your tongue out. Okay, that looks fine. Just look at your eyes. And just look at your fingernails, my love. Okay. Just looking at your skin. Okay, so you look, I wouldn't say you're dehydrated, my lovely, which is good. And overall, you do look fine, you do look quite well, but I can tell that you are in a lot of pain and a lot of discomfort. All right, yeah. And because you don't feel like you need to go to the toilet either or, you know, you don't appear to be constipated, but you don't have diarrhea. So it's definitely needs to be sent over to a gastro. So there's no signs of, you know, gallbladder inflammation or like appendicitis or anything like that. So it's not like severe, but, you know, we need to get you in with a gastroenterologist. So you need to stay hydrated, all right? Eat little, gentle foods, okay? But I need to send you over to the gastroenterologist's ward. and get you to see a specialist, and they will have a really good feel around. They'll do some scans, different tests that they'll do, and they can come up with what's going on. Yeah, I think that is the best place to go. Just by checking you, there's definitely something going on, and I don't want you going home in this state. No, you definitely need to stay here, but go over to the gastroenterologist ward, and one of the doctors there will go through things with you. Obviously, I will send all the information over. Let me just check your temperature, my love, okay? I'm just going to pop it in your ears. Okay, so you don't have a fever, which is good. If I could have your index finger. Check your oxygen levels and pulse. Oxygen levels are perfect. Now your pulse is quite fast, but if you are in a lot of pain, it will be. All right, my lovely. Okay. All right. How are you feeling? Okay. So the fat lump needs to be assessed by a specialist as well. It needs to have a scan on there and see if it is, obstructing anything in you, and see if you do need to get it removed and things like that. But at the moment, my concern is the inflammation of the bowel and obviously your symptoms. Okay. So the best thing for me to do is get you sent over there. Okay. Other than that, I'm not concerned about anything, my lovely. It literally just whatever's going on with your bowel. Now, it may well be IBS, and it's just it's a bad flare. It's your first flare. Maybe it's just worse, or it could be Crohn's disease, and that's suddenly why it's hit you, or something like that. So, have you got a history of anyone in your family with, any Crohn's disease or any bowel disease or anything like that? Okay. All right. Okay, my lovely. So I'm going to keep you here. All right. I'm going to go and sort some things out, get you transferred to the right ward, fill in the gastroenterologists with all the information, and then they will come and basically do what I've done again, read my notes and my opinions, and then go from there. Okay, my lovely. All right. I'm sorry you aren't feeling well. All right, you take it easy and just sit there, okay? Please drink plenty of water, but steady, slowly, don't guzzle it. All right. Now, do you feel sick at all? Okay, do you feel weak, a bit tired? All right. Okay, I don't want to give you any pain relief, my lovely, or any anti-inflammatories, or anything for the cramps. Okay, I want to leave that for the gastroenterologist. I think that's important for them to do the right assessment and then treat accordingly. I don't want to do something and then that's going to make it worse. All right. Okay, because obviously if I can give you cocodamol and things like that, that can block you up, because that can cause more irritation. We don't want that at this stage. All right, so they'll probably get you in for some scans, ultrasound, and probably an MRI is what I'm thinking. But I'll leave that for them to decide. Okay, now I'm going to leave you be. It was lovely to meet you. Sorry in these circumstances, and I hope you do feel better. And hopefully we can get to the bottom of this. All right, but with the right specialist. Okay, my lovely. You're very welcome. Oh, you take it easy. You take care now.